So this is our agenda for today. This is our usual setup. We have some news updates, and then we have a presentation that we are all very excited about by Guillaume Fontaine, who is joining us from Canada to talk about some of his amazing work in thinking about theories, models, and frameworks, and how to think about AI-enabled methods. But I will do a more formal introduction in a moment. We will be recording this session, so those of you who are watching it online, hello as well. And these are usually posted on our ECTRI AFT webpage, which is linked there. And so we can go to the next slide. So the news and updates, we are planning a workshop which is going to focus on applying the translational science benefits model. This is put on by the DNI Science Center and the Implementation Science Hub here at UCSD. It is planned for June 15. It will be virtual, synchronous, and what we are planning to do here is to apply the considerations of the TSBM in the context of HIV research, but it could be applied outside of that. If you are interested, please go ahead and register. It is a free workshop. Also, feel free to share it with anyone in your groups who might benefit from it. We have done a couple of these in piloting this workshop locally, and it was received with great excitement. So hopefully we can make this available more broadly. We can go to the next slide, Kelly. Then also just reminding you that the AFT group is continuing to have meetings in June. Dr. Linda Salgen will be presenting on an adaptation study that was conducted in the context of the COVID-19 testing program. We are taking a break in July and August, returning in September, and we have plans for September, October, and I believe even actually November. So if you are interested in presenting, please nominate yourself or nominate someone else who you would like, just like Guillaume was nominated by me for this presentation. So please recommend other presenters as you see them come through your institution or otherwise. We can go to the next slide. And these are just the November and December sessions that are already set, but we are opening it up already for 2027. So if you have presentations, do not hesitate, do not wait, please let us know. Okay, next slide, please. And no more delay here. I would like to introduce our wonderful speaker. Thank you so much, Guillaume, for coming to us today. Dr. Fontaine is an assistant professor of implementation science at McGill University's Ingram School of Nursing and Department of Global and Public Health. He directs the McGill RISE Implementation Science Lab. And Guillaume, you will have to tell us, is it RISE 3 or how you usually reference it? He's also principal investigator at the Center for Clinical Epidemiology, Lady Davis Institute. Additionally, he holds visiting appointments at the Kirby Institute in Sydney and the Center for Implementation Research at the Ottawa Hospital Research Institute. He co-leads the implementation science research stream for the CIHR Canadian Network on Hepatitis C and co-leads the methods think tank for the Pan-Canadian HIV and Sexually Transmitted and Bloodborne Infections Clinical Trials Research Network. He serves on the steering committee of Knowledge Translation Canada. His research program focuses on applying and advancing implementation science frameworks and methodologies to improve healthcare outcomes with a focus on infectious diseases. And so with that, I will hand this over to you. Thank you again for being here. Would you like to take comments throughout, or should we collect them in the chat?
Perhaps at the end, and we collect
Wonderful.
them in the chat, if that's all right.
Perfect. So we will let you share your screen, I think, and then we will collect everything in the chat. So please use the chat, put your questions in, and then we will help Guillaume sort those through at the end.
Excellent. So you can see my slides?
Yes, really well.
Great. Thank you so much for the introduction, Borshika. It's lovely to see you again. I'm quite excited to be presenting on this program of research today on AI and implementation science. So it is a multi-phase program aiming to develop a framework, toolkit, and reporting standard for AI-enabled implementation practice and research. And we've completed some of the work, but we still have quite a long way to go to get to those outputs. So I'm going to be presenting on where we are now and where we're going. Here are my disclosures. So I'm going to be talking about mainly 5 points. So first, a bit of background and rationale on why do we need AI in the context of implementation science today in view of the challenges that the field is facing. Then presenting a high-level overview of the AI Methods for Implementation Science, or AIM-IS program. I'm going to be presenting as well some of the findings of the living scoping review, which we've just completed. We've also completed pretty much the qualitative interview study and some findings related to that, and then some next steps and implications. Before I get into that, I just wanted to say, so I lead the RISE lab, so no need to say the three Borshika at McGill University. So for those who've never visited Montreal, I would highly encourage you to do so and to visit McGill and let me know if you're ever in town. But so in the lab, I lead a team of about 15 to 20 PhD students, research staff, and master's students and postdocs. We conduct research, broadly speaking, in very general terms in three areas. So implementation research to promote uptake of prevention testing and treatment for HIV and viral hepatitis, so mostly related to applied public health research. The second area, we conduct a range of large-scale evidence synthesis and systematic reviews of public health interventions, but also of implementation science interventions and strategies and frameworks. And then the third area is really around the development of theoretical and methodological approaches and implementation science. Some of that I'm going to be presenting today around AI and implementation science. So, background and rationale. Why AI? Why at the intersection of implementation science? And why do we need this now? So I'm not going to be staying too long on this because I know that you're probably aware that there are persistent no-do gaps and health systems globally face a range of translation problems around the pace of implementation. So often implementation is slow, uneven, and sustainment is difficult. We have a range of issues as well on low-value interventions, low-value practices, harmful practices that are persisting and consuming resources. And then we still have a lot of work to get to the quintuple aim, including better outcomes, experience, efficiency, equity, and workforce well-being. But in the context of implementation and implementation work, really, we have some specific challenges. The challenge of implementation work centrally is that it is really resource intensive, context sensitive, information intensive, and also equity critical. Implementation work really requires us to look at large volumes of data from different sources. It can be from records, from the empirical evidence, from experience, from theory. So we have different sources of data that we're trying to triangulate to make the best possible decisions. And that's a challenge in itself. We also have a range of evidence sources across disciplines, sometimes conflicting, and different schools of thought within implementation science, which can be a strength, but also a difficulty in making sense of the body of theoretical evidence, for example. Then we also have challenges around adaptation, of course, and sustainment. And if you look at the field of implementation science over the last 2 decades, of course, we've had major conceptual advances, and there's been increased adoption of implementation science. If you look at just the citations in PubMed and the trend of implementation science and new publications, but we have a vast and rapidly expanding theoretical landscape. We have over 800. We've done an umbrella review of all implementation science theories, models, and frameworks, which we've updated in December, and now we're up to 810 unique theories, models, and frameworks. And we've made progress in the field over determinant frameworks, implementation strategies, We have a range of implementation mechanisms, a range of mediators. We have different outcome frameworks. But as the field gets more and more sophisticated and more expansive, it does lead to some challenges in the uptake of implementation science and the fidelity to how the tools of implementation science and the TMFs of implementation science are used and applied in real world settings. And especially if we look at what happens when there's limited resources and experience and capacity for implementation science. So if you look at the opportunity of AI within the field of implementation science, it may help us do a range of things. It may help us interpret large volumes of data, uh, look at different patterns, look at strategy selection, tailoring, helping us with monitoring and evaluation over time, but also perhaps enhance our methods and our theoretical approaches by helping us make sense of those 800 TMFs to see if, we have overlaps, conceptual redundancies, refinements to potential constructs, and so on, and also highlighting some gaps potentially. We have a number of opportunities. Like I said, it could help us to better synthesize evidence, better identify barriers and facilitators from data. It could help us match barriers to implementation strategies using different models. It could help us generate, adapt, tailor implementation tools like patient-facing implementation strategies. It could help us track fidelity, reach adaptations in real time, looking at massive amounts of data, and also, like I said, refine our methods and theories by identifying cross-setting patterns across studies and other sources of evidence. But importantly, what I think is something, conceptually to consider is that the use cases of AI in implementation science are highly heterogeneous, because you have some use cases of AI that can be centered, of course, on implementation practice. You have some use cases of AI that might be centered on implementation science, implementation research, on methods, and on the design of studies. And you also have use cases of AI and implementation science that can bridge practice and research. When you talk about learning healthcare systems and infrastructures that bridge evidence that's generated from healthcare, routine healthcare to informing research. These use cases differ in their users, their workflows, the decision points at which AI may help to support implementation, research, and practice. They're going to need to be governed in different ways, and also they're going to have different consequences. AI also introduces significant risks. So we know, of course, I'm sure you all know that, we have issues around bias, inequitable performance across groups, hallucinations, unreliable outputs, over-reliance of humans on AI, which is becoming more and more of an issue, challenges around privacy and data governance, important challenges around how it fits in workflows, especially when we talk about new and more complex tools beyond generative AI. And the accountability around those tools is often unclear. So the point of the justification of the AIM-IS program of research is that without shared approaches to classification of these use cases, looking at also what are the guardrails that we need to put in place, how do we evaluate those use cases, and how do we report those use cases, we're going to have limited cumulative learning in the field. And I can tell you by looking at the evidence that the adoption of AI in implementation science is quickly expanding, and we need to act. So here comes the AIM-IS program of research. So we've published a protocol for this last month. So about a month ago in implementation science with a team including professors from the UK like Susan Mickey, but also from the US, Rina Bedas, Elvin Gang, Byron Powell, also from Australia, Natalie Taylor, from Switzerland, Jana Hastings, and from India with Ashrita Sahan. So it is a really nice team with complementary expertise at the intersection of implementation science, but also data science and AI. So what is the AMIS program? So it is a multi-phase, multi-method methodological development program to develop, validate, and maintain a suite of linked products to guide the responsible use of AI across implementation practice, implementation research, and bridging use cases. What we are looking at in the context of this program of research is really the use case of AI in implementation science. So what we mean by that is that we're looking at a specific AI capability or AI model within the context of a specific implementation research or practice task within a workflow, within a decision point, and within a governance context. So this is really what we're looking at classifying, but also supporting better evaluation of and also better reporting of are these use cases of AI in implementation science. Um, we also are grounded in evidence with this review that we're conducting and also this qualitative stream of evidence and also a Delphi that I'm going to talk about, really across the implementation practice continuum. It's also structured according to a living approach. So we're conducting a living review that's going to be updated, but the products as well are going to be versioned and they're going to be updated as the field evolves. And we're guiding by different frameworks, the knowledge to action model, which is a well-known process model, and implementation science to help figure out where the applications of AI fall across the action cycle, but also a socio-technical systems lens, an equity lens, also principles of human-centered design, and also guided by some other responsible AI frameworks that are not designed for implementation science, but are applicable in healthcare. We have 5 objectives. The first one being to map the published use cases of AI in implementation science. The second one is to explore the perspectives of different interest holders on the use cases, the feasibility, the governance, the outcomes, and all the aspects that we want to explore. Then the third aim looks at integrating these findings to develop the draft AMIS products. We're going to also have a consensus process to finalize those products. And we're going to have a fifth objective looking at testing and refining those products in terms of clarity, usability, and how they fit in real workflows to support the first final version of those products. There are a number of terms that we're using in the context of this program of research. The AI for implementation use case I've already talked about, and it's really a use case of AI in implementation science or practice or bridging context. An AI capability for us is the technical function performed by an AI system that can be to extract information, classify information, predict what's going to happen in a sequence of text, for example, summarize information, generate new information or different recommendations. And then we have implementation practice facing use cases, research and methods facing use cases, and also bridging use cases. And I'm going to just talk a bit more about that on the next slide. And these are happening at different decision points at different times. We need human oversight of these use cases as well for accountability in terms of how those outputs are going to be interpreted and also how people act on them. The guardrails are the minimum conditions for responsible use of AI. We have also the core outcome domains, which are the things that could be evaluated when a use case is deployed in implementation practice or in implementation research. And the minimum reporting standard are the things really that should be reported when a use case is published. When I talk about the different use cases, I refer really to a continuum of use cases. And this is something that perhaps is going to evolve conceptually because as AI is increasingly adopted in different facets of implementation, research, and practice, sometimes the lines can get a little bit blurry. At this time, most of, if not all of the uses of AI in implementation practice are not captured by the evidence because they're not published. And we know that AI is used to a pretty wide extent in terms of supporting different implementation practice tasks, sometimes not necessarily in a way that's structured around implementation science frameworks, but it is something that's done at this time. And then we have at the other opposite end of the spectrum, those research and methods facing use cases, which I'm going to talk about a bit more in the context of the findings of the living scoping review. And then we have those bridging use cases that I've talked about before, that are, you can think about them as really learning healthcare systems centered on data that bridge practice and research. Those are the 5 phases of the program, aligned with the 5 objectives. So the first one being the living review, the second one being a qualitative study, and the third one is integration through convergent mixed methods. And then we have a Delphi process for phase 4 and phase 5 usability testing and product development. And we're also going to do some translation of products to a range of different languages to promote accessibility and also updates. The different outputs that we're going to aim to have in the context of the AIM-IS program is, first of all, a framework. And this is going to be a common structure to classify, govern, evaluate, and report the use cases of AI. So it's going to be a conceptual representation of how those different pieces fit together for different use cases. The toolkit is going to include 4 subcomponents. It's going to include a taxonomy of use cases, both for implementation, practice, and research. So think about it as a list of different use cases. It can support evaluation in this way. It can support theory refinement in this way, for example. The guardrails is going to be the minimum requirements, like I've mentioned before. We're also going to have a guide to help apply AI to implementation science for the most common use cases that we see in the evidence and perhaps those that are emerging. And then the evaluation guide with the core outcome domains. And I've mentioned already the reporting standard. So we hope that together, all of these things will support better specification, classification, governance, evaluation, and reporting of AI in implementation science. And we aim to accomplish this over a period of about 2.5, 3 years, and we're already a year in. So the living scoping review, phase 1. So I'm going to present some of the findings that we have on how AI is used in implementation science today, is some of the baseline findings of the review. So the foundational principle of a living scoping review, or any sort of living review, for those who are maybe less familiar with that, is a review that's going to be updated. The searches are going to be updated according to often a predetermined frequency. So let's say every 6 months, every year, and then depending on the evidence base that's accumulated since the last publication of the findings, you might publish again another review after that, an update of the review. So it will depend, but I will say that we did a first search for this review in July 2025, where we found 28 articles reporting on AI and implementation science, different sort of applications. And then we repeated the search in April 2026, and then we're up to 40 articles. So you can see a gain of about 12 new studies in less than a year. And there's also rapid acceleration if you look at the trend. So what we're going to aim to do, we're going to submit this first iteration of the review to implementation science this month. We're going to aim to publish it at least once per year for the next several years. It's a typical, I won't spend a lot of time on methods, but basically typical methodology for scoping reviews and living reviews with a range of data sources. What I will say and spend a little bit more time on is the eligibility criteria and the exclusions. So really, we're looking at including AI that supports implementation practice or research tasks, the work underpinning implementation practice or research in any healthcare context, and any sort of sources. It could be empirical, but also conceptual and potentially methodological in nature. But I want to talk a bit more about the exclusions, because this was a really quite tricky conceptually to figure out what we were including or excluding. And over time, as the body of evidence evolves, we might refine the eligibility criteria and decide to include or exclude different things based on how the evidence landscape is evolving. But we had to exclude all clinical applications of AI that support clinical decision making. So all of those that focus, for instance, a good example of that is, algorithms supporting diagnostic processes, because that's related to service and clinical outcomes. We've excluded clinical decision support systems because these support primarily clinical decision making at an individual level and are not primarily affecting implementation practice and research and the outcomes related to those tasks. We've also excluded general applications of AI to evidence synthesis, automation, screening, and all sorts of the different steps in doing a systematic review, because that's also very much a separate evidence base. We've also excluded knowledge product generation. So, for example, generating using large language models, patient-facing educational materials, or patient-facing decision aids, for example. Because again, this is knowledge product development and not really implementation, the tasks underpinning implementation practice or research. We've also excluded a number of provider and patient-facing tools. Some of them you could conceptualize that we've excluded as patient-level implementation strategies. So, for example, a chatbot supporting adherence or fidelity to a given intervention. In some instances, we've included when those were provider-facing, but a lot of the patient-facing tools we've had to exclude from this first iteration of the review, given the body of evidence that's quickly expanding. So this is the result of the first, these are the results of the first search with the 28 sources. We're up to 40 sources, so I don't have slides yet for the 40 sources, but it paints a similar picture. I'm going to show you one slide for the 40 sources from the update. We have 14 primary research studies looking at applying AI in the context of implementation science or practice, 6 conceptual and methodological papers with 3 study protocols, 2 reviews, 2 conference abstracts, and 1 report. Most of the evidence is coming from the US, and then some representation from Australia, Canada, and other countries. If you look at where AI is being applied across the action cycle, pretty much is there's a concentration of applications of AI in data-rich, codifiable, later stage implementation tasks. So primarily helping identify barriers and facilitators, helping select and tailor implementation strategies, helping implementing and monitoring different sorts of interventions, and also helping guide evaluation. So some examples include doing some text mining, sentiment analysis for barriers and facilitators, for implementation strategies, matching barriers and implementation strategies using machine learning techniques, for implementation and monitoring and sustainment. There's also an example was prediction of the fidelity and the sustainment of different interventions using different AI techniques. And then in terms of supporting evaluation, of course, large language model are now coming in to assist with different sorts of analysis, like qualitative analysis. So those were some of the most common applications that we saw for those 4 categories. In terms of the AI approaches that are used, when we did the search in July 2025, and that's shifted a little bit this year, the most common AI approaches that were used were traditional machine learning techniques. And then we saw some representation from generative AI with 3 out of 19 applications, and then some more traditional techniques like knowledge and rules-based AI that are not leveraging any sort of advanced learning paradigms. And we also had 3 applications that leveraged hybrid or ensemble approaches, meaning that they leverage machine learning in combination with other things like natural language processing or some other AI technique. This is the trend in AI technologies, and that's up to July 2025. And on the next slide, I'm going to show you what it looks like up to April 2026. So you can see that really the first paper that we captured is in 2013, and the black dots represent an actual AI system that was developed, tested, evaluated in the context of a study, whereas the other boxes with no black dot represent more conceptual or methodological papers, generally speaking, on AI and implementation science. And then you can see which technologies are linked to those different sources. And you can see that generative AI is starting to come in 2025. So this is the update in April 2026. You can see that there's a definite increase in 2025 with now 14 studies being published that we've captured in 2025. I wouldn't be surprised if by the end of 2026 we're up to, in that year, 25, 30 different sources. So I think we're on a bit of an exponential path. And you can see as well that there's more sophisticated applications of AI and implementation science that are starting to emerge as well in 2025 with a lot of generative AI, deep learning, and combination approaches. So if we look at, the evidence base as it stands now, there's a lot of the evidence that's centered on research prototypes. Only 3 systems were piloted in real world settings. No study that we've captured so far, both in the first search in 2025 and the one in 2026, evaluated agentic AI, multimodal AI, or custom GPT-style systems. Largely absent as well are those that are focusing on reinforcement learning, autonomous decision support systems. And really, if you look at what's happening in the clinical AI literature, we're already seeing some EMR-embedded agentic systems that leverage different sorts of AI technologies to support better clinical decision support. So I would say that implementation science is behind in terms of the complexity of the systems that we're seeing entering the field. And if you look at how those systems are being evaluated, those in implementation science that we've captured so far, there's a big focus on technical validity. So we've mapped the different categories of evaluation, if you would say. The first one being technical validity. So looking at whether the systems can be cross-validated to a different data set, or whether you have an analysis of the different errors that the system might make. We have some comparative value evaluation. So for example, in the category D, we have the number of studies that compared an AI-assisted workflow to a human-led workflow. So that is starting to emerge. And then we have at least, 13 out of 19 studies which evaluated the effects of that system on at least one implementation outcome, which is a good start, but there are a number of gaps, especially when it comes to equity and human-centeredness of those systems. Some of the reported risks and key research gaps. So 7 of 28 sources reported different risks. A number of those risks were really AI specific. So the authors talked about bias, fairness, different hallucinations, poor data quality, and so on. A few mentioned some system level risks like workflow disruption or poor fit in the service. Some mention as well user level risks. But importantly, no study measured clinical or patient level harms, and the environmental and societal costs of AI were never mentioned in any of those studies. Some of the priority research gaps that we're deriving from the review are that we need potentially broader applications of AI to earlier implementation stages. For example, we didn't have any sort of, I believe, any sort of application of AI to guide the adaptation of interventions or guide how an implementation challenge is framed or conceptualized with partners or guiding how we engage and map different stakeholders, for example. So all of those earlier tasks were really not represented in the landscape of the evidence. Um, we also suggest that we need more comparative studies and randomized studies of different AI models compared head to head, or additional more complex experiments using variations in the way that those systems are designed. We need to validate those systems across different settings, languages, and contexts, measure how it performs in different subgroups, and then develop consensus reporting outcome standards, which of course we're aiming to do. So some of the takeaways from phase one are the following. AI and implementation science is really in early stage, but rapidly accelerating. I expect that by the end of this year, we're going to have around 50, 55, 60 studies, up from 28 last year. Applications at this time cluster around all of those data-rich tasks around evaluation, analysis, monitoring of implementation. And we see as well that the field is moving faster in developing those systems than in conducting rigorous, large, or not even large-scale evaluations, just real-world evaluations. And also, we have to keep in mind that most, if not all, of the real world use of AI and implementation practice is not captured by this review and likely unpublished. So in the wild, and we have to figure out a way as well to capture that evidence as we're going to aim to develop those standards in the next phases of the program. So for the results briefly of the qualitative study, I'm going to present a little bit on the perspectives on the feasibility, benefits, risks of AI and implementation science, according to the interviews that we've conducted. So we've conducted more than 21 interviews, but those results are for the 21 interviews, the first tranche of findings, but we're also conducting now some additional interviews with stakeholders in low and middle income countries to have more global representation in the findings. So we're conducting interviews with interest holders in Indonesia, Nigeria, Ethiopia, a range of other countries to look at also their perspectives on AI and implementation science. We had three research questions. So feasibility, benefits, and risks, pretty simple. We've conducted semi-structured interviews via Microsoft Teams. So far, we've interviewed 9 implementation researchers, 6 implementation practitioners, 4 AI experts, and also 4 health services researchers. For the first research question on feasibility, some of the individual level factors influencing the uptake of AI and implementation science. First one is really that stood out is the need for transparency and explainability as a prerequisite for trust. So we've seen repeatedly that users demanded, where are the outputs coming from? How were conclusions reached by the system? So that aspect of traceability and explainability was critical. Some participants emphasize that commercial tools make this more difficult than open access tools. An implementation AI expert mentioned to have that transparency of how we got to that response, to not have a black box. People's lives are at stake. There's no room for that type of error. The second aspect that stood out for this dimension was knowledge, skills, and technological literacy. A number of stakeholders are saying that AI literacy is a prerequisite, and without it, AI creates fear, misuse, and disengagement. So stakeholders emphasize the need for co-designed systems that can be fit for purpose for implementation science to really build trust and that literacy at the same time through engagement. One of the quotes for that dimension was that these systems are not that hard to use. They're hard to use well. There's a skill level that people need to get trained. Then the other aspect that stood out is the tension between speed and quality. The efficiency that AI brings was welcomed by pretty much all participants, but really conditional on maintaining methodological rigor inherent to implementation research and practice. We don't want to normalize shortcuts in research and evidence generation. So a participant said, I have some reservations about going as fast as possible because I think that we don't learn when we prioritize expediency over taking the time and really digging in. Now, some of the organizational and infrastructure factors. The first theme that we have is really around organizational culture, leadership, and governance, and that clear institutional policies, governance structures, and guardrails for AI are essential. And that was really a standing point across a range of participants because without those, there's fear, hidden use, and really ethical risks. And then really the critical importance of leadership endorsement that can shape how AI is adopted and valued within the organization. Um, the quote was, historically, hospitals are risk averse, but because AI is so fast and pervasive, some are adopting quickly for better or for worse. Whether they're putting the guardrails in place is another question. The other theme for feasibility at a broader level was the need for interdisciplinary collaboration. AI for implementation, research, and practice requires team science. No single person holds all the necessary expertise. Some people might do, but those people are pretty rare. That's my 2 cents. The key challenge is bridging implementation science, AI, data science, clinical, and also community perspectives. Someone said, you need people who are skilled enough in both disciplines to act as mediators or translators, and those people are pretty rare. The third theme in this category was the need for, of course, data and technical infrastructure and the garbage in, garbage out problem, looking at the fact that within healthcare, generally speaking, we have so many, in many, and that's really, of course, highly variable across healthcare systems and countries, but paper-based records or hybrid systems, fragmented systems, lack of interoperability between systems, the databases are not coded in the same language, a range of different issues that can preclude us from really using the data for implementation practice and research in a good way. We have so little data. What we have doesn't represent much. If we don't have the data to ask the right questions, we won't get anything out of it. Now, for some of the perceived benefits, the most cited benefit was really around accelerating evidence scanning and synthesis. So AI, and we see it, for those people that can use it, could really compress the 2 to 3 year systematic review process, for example, if we want to look at implementation evidence, support living systematic reviews, accelerating screening, extraction, summarization of implementation evidence. Someone said, if there was a platform I could trust, quickly know the evidence, the gap, crowdsource barriers, map to strategies, I've taken a 2 year process into a few weeks. The second most cited benefit was the evidence to implementation strategy matching. AI could systematically help link, identify barriers to facilitators to implementation strategies. You could build an algorithm. Here's my problem. Help me calibrate as well the right theory, model, or framework. Not right now, we rely on experts. And that one was also linked to using it to select different implementation science theories, models, and frameworks. The third most cited benefit was around enabling independent and sustainable implementation. And I think the quote speaks to that. We can't have an implementation scientist in every service, but we can leverage AI to give them a skill set we can't afford to give otherwise, to really promote more autonomy in terms of implementation practice and research. Some other more general benefits that were cited, and I'm going quickly over this because, as you'll see in the full paper, there's a number of additional benefits and areas of application. Our general workflow efficiency benefits. There were, of course, a number of other benefits that were cited in terms of data collection and analysis, So organizing, cleaning, managing structured and unstructured data more efficiently, using AI as a member of the analytical team, a second coder, a validator, a pattern identifier, and so on. And then the last benefit that I want to highlight was that it can be potentially equity promoting and accessibility promoting if it can help us generate plain language summaries, translate materials, and so on. Now, of course, a number of risks were highlighted by participants in terms of the reliability of data, the representation of the data as well. I won't go over those in detail, and I can share my slides if you're interested in learning more because I've already talked about them a little bit at the start of this talk. But there's also a range of concerns around data privacy, ownership, consent, concerns around human responsibility, judgment, and also professional identity. So what can AI do to how we think about ourselves in terms of an implementation scientist or an implementation practitioner? How is that going to change? A number of other risks were also mentioned around replicating, exacerbating biases, a range of biases. Structural inequities in access to AI as well were highlighted. The risk of a postcode lottery where the access to AI is really depending on institutional wealth and geographical provenance, and especially as we move towards more advanced models where they require more computational power, then we might have more and more issues in terms of access for some low resource settings. And then concerns around environmental sustainability also emerged, and also geopolitical and economic concerns. So I'll share my slides if you want to read a bit more about those different risks. So I'll end by talking briefly about the next steps and some of the implications of what we're building. So next, starting this summer, we're going to do an integration process to really look at deriving the draft AMIS products from the review and the qualitative study that we've conducted. And that's going to quickly move into a consensus process, so an eDel5 process. So if some of you would be interested in participating in validating the framework and the other outputs as well generated by the project, we'd be happy to have you be involved. And then, as I said, we're going to do next year some usability testing of those products once we have a working version of all of those. So I wanted to end with some implications about what I think we should know about AI and implementation science today. So first of all, the field is moving really fast at this time. We see more and more papers being published, and we see a broader range of uses of AI. And I think what we're seeing also is that the momentum in generative AI is dragging up the other sources or other forms of AI that perhaps were underused in the past. So I think the field in itself is really moving forward in a good way. But one of the issues, like I've mentioned, is that much of the use of AI in implementation practice is informal, perhaps undisclosed, and unevaluated. So we have to figure out a way to work with that. And the other point that I want to talk about is really go back to is the use case of AI as the object of analysis and evaluation and not just a tool. So really thinking about how a specific AI system or tool fits within the context of the work and also the organizational context, and that's the unit of analysis and evaluation. We need human oversight, and that's a bit of an editorial point, but I think we should aim for a paradigm where AI is augmenting and not replacing human judgment in relationships. I really think the relational, contextual, and ethical dimensions of implementation work cannot be automated, or at least should not be. So I'm curious to know what you guys think. We need to think about equity, representation of key groups in the data, and then going back to the need for evaluation and reporting standards. So I'll end on this, and hopefully we have a little bit of time for questions.
Thank you so much. Fantastic, very rich discussion. We have a number of questions, so I'm not even going to wait too long to jump right into the chat. Some of them, and let me help you navigate these. Could you talk a little bit about the examples of included research tasks in the AI find articles that you included in the review? There were a couple of questions about that.
Yes. So so essentially you want some examples of how it was the different use cases, right, that we've captured in the review. So one of them is an example. I think I can give four examples. So the first one is about automated fidelity monitoring of counseling sessions. So using the data that's generated from recordings of different sessions, an AI algorithm or model is able to look at the data and assess the extent to which the intervention is being delivered as intended. So that's a clear implementation outcome in terms of fidelity. That's one example. Another example is looking at geographic and public health data within the region. So in Florida, what they've done is that they've used that geographic and public health data to really prioritize and target where implementation efforts should go. So
Mhm.
geographic and priority targeting using that data is another example. And they've done that for needle and syringe programs for harm reduction, how they should go in a region. Another example is, of course, supporting qualitative analysis with large language models. That's another example that's quite common. And then another example is, I think it was in pharmacies that they've leveraged AI. They've had pretty large databases on different barriers and facilitators to the delivery of an intervention in pharmacies. And then they've used this database of barriers to model what would be the best implementation strategies for this context in the pharmacies. So using some machine learning techniques. So there's a range of other types of uses. Another example is that I believe for a framework that was published last year, they've actually used AI to help guide how they conceptualize the constructs in their model. So that's another application. So you can see that it ranges from, leveraging on the ground data to, conceptual and methodological advancements and applications. So it's pretty diverse.
Wonderful. Another question, a little bit different angle. Do you know what proportion of the AI systems evaluated are using open source data training methods? Is that criteria of interest for AMIS? Proprietary AI systems do not typically reveal what data sets they were trained on.
It's a really, really interesting question. I believe so. What we've done, and you're going to be able to look at it in the context of the review and the data set that comes with it, we've mapped what is the model being used, right? What is the tool and what model? So if it's generative AI, large language models, that's one thing, right? Okay, but it's ChatGPT version 5.2 and so on with these parameters. So we've mapped, all of those things in detail. I don't know the extent to which there are some open source models that are used. We've seen quite a few, especially in the last year, commercial models being used in the data. Before 2023, 2024, most of the use cases of AI were not around generative AI, because it really didn't exist, but they were leveraging machine learning techniques and models, and often those were developed in a research context by a research team. So it wasn't a commercial product, but more so something that was developed by a data scientist, in the context of a study. So I would say that so perhaps some of them could be conceptualized as open source, but we would have to look closer into those models to see.
Wonderful. Thank you so much. Another question is related to accountability metrics. If an error is made in a decision, would the human agent take 100% accountability? Not sure if this is something you are exploring in the context of this review.
That's a good point. I think that's something, for us to decide as a community. And as we develop those standards and we look at the context of implementation science, I would be curious to know what Borshika you think, and Russ you think as well, and and I think it's something to figure out as we develop those resources for implementation practitioners and researchers, but I don't have a clean answer to that.
Wonderful. I'm looking through, I'm sorry, there are so many comments. I'm trying to get as many in as possible. I think there was a question about accuracy, reliability, ecological validity. I think we talked about that. Russ, why don't you jump in? You had a different question, perhaps, and then I will continue reading through these.
Okay, I will. First of all, thanks so much for doing this incredible program of research and team you have with you. So impressed, and thank you for doing this for the field. My question, or quick comment, and then a question for you, has to do with the evaluation reporting standards and things there. I think that's so important, not only for AI, but in general. But I wonder if you could expand just a little bit on two aspects, the reporting standards. One, the comparator. I'm intrigued with that. I think we see that too little. And then second, the environmental impact. And just to show my naivete, is it possible for a particular use of AI to report that environmental impact of just your use there?
So that's so very interesting questions. I think for the comparison aspect, we have to think about, what is the value that's going to be afforded or generated by that comparison, right? And I think to me, at this stage, we have relatively little prospective evaluations of fully AI autonomous
Yep.
workflow for a given task
Yep.
compared to what a team of humans would do, or just a single human would do. So I think we do need more of that, but we have to decide which metrics are we evaluating in the context of that. Is it accuracy? Are we
Yep.
we talking about errors? Are we talking about time? If we talk about time, of course, perhaps this kids could always be in favor of the. I would be surprised that humans would be quicker than AI for 99% of the tasks that we need to do. So, but I don't think it's just a matter of looking at efficiency and time. We have to factor in other aspects in the evaluation. And perhaps there's something to say about, what is the societal impact of the use of AI in that ratio, and also what are we losing by using AI in the context of this task, beyond gaining efficiency and gaining time. So I think that's interesting to think about in the context of the comparisons and the evaluations. And then we might have gains of assessing different models head to head. Of course, we have a range of different types of models, and some of them can be local, right? We don't need to access the cloud or to access the internet. Now you can download some models on your computer. So I think it's also, can some of those tasks in implementation science actually be done by local model that are not linked to the internet, that preserve privacy and also are less, you know,
Environmental.
have less implications for data
Yes.
security and so on, rather than some big models. So I think that's why we need to compare models. And then the other aspect was, I think for the environmental cost of AI, there's actually software that you can do that you can use to estimate the environmental costs of a task.
Yeah.
And I don't remember the link. I've tried it once or twice, but I could share it, and it's pretty interesting. So estimating the costs of
Oh,
a task or a workflow could it's something we can do.
thank you.
Wonderful. I realize we are over time, but this could continue for another several hours. Thank you so much, Guillaume, for being here. We really appreciate the amazing work you are doing. This will be posted, including I believe, the PDF version of the slides. Thank you for being here, and we look forward to seeing you all in a month. Thank you.
Thank you, everyone. Bye bye.
Bye.